Now let's talk about the testing that can be used to help diagnose a patient with tuberculosis. Because as the nurse, you're going to play an important role in administering some of these tests and interpreting some of the results. So first, let's talk about the PPD skin test. This has a lot of names. It's also called the Mantoux test, TB skin test, tuberculin skin test. You may see it abbreviated TST. All of it's the same thing, it just has a lot of names. Now what is this? Okay, this is where a patient is injected with purified protein derivative with a tuberculin needle, it's a special needle, on the inner part of the forearm. And as a nursing student, and I know as a nurse, you have had this type of test done. And after injection, it will look very similar to this picture right here. It will be nice and raised up after they have injected that into the forearm. Now, whenever you give this test to a patient, you have to tell them that they have to come back and you have to assess the site, or someone else who's qualified, the site within 48 to 72 hours. And anything over 72 hours, they'll have to repeat it. And what you're assessing for is in duration of that injection site, which is it hard and raised up? And you're going to measure it in millimeters. We're not looking at the redness, we're looking at the in duration. So how do we interpret results? And I would remember this for testing purposes, because the results are based on certain criteria based on those risk factors we just went over, which is why I wanted to cover those with you. So you're measuring the site. If it measures 15 millimeters or more, that is positive in everyone. If it measures 10 millimeters or more, that is positive in a person who's an immigrant, an IV drug user, works or is living in one of those tight living quarter areas, or a child less than 4. If the site is 5 millimeters or more, that is positive in a person who has HIV, or if the person's been in contact with another person who has active tuberculosis, they've had an organ transplant, or their immune system is suppressed. Say that they're taking drugs that suppress it. So that would be considered positive. Now, just remember that just because a patient has a positive result doesn't mean that they have active tuberculosis. They could have latent, or they could have active. So you need to get a chest x-ray and a sputum culture to help